Clerk will read the next bill.
House Bill 3268, relating to telecommunications.
The question now arises upon third reading and final passage of House Bill 3268A. Representative Keny-Guyer.
Thank you, Mr. Speaker. Colleagues, House Bill 3268 aims to increase utilization of the federal phone Lifeline program for struggling families in Oregon. The program provides phones to Medicaid members, many of whom are homeless, to connect them to services. This bill came from Care Oregon, who brought it forward on behalf of the Oregon Health Plan clients it represents. Having these phones allows healthcare providers to remind patients of their appointments, to reach out to patients who are trying to quit smoking with the Text to Quit program, and to help patients with diabetes report their daily glucose levels, and pregnant patients report and control their glycemic levels. The Healthcare Committee heard passionate testimony from citizens who came to let us know how vital this phone was in their lives. A homeless gentleman fighting addiction who called his phone his sponsor because he needed to reach his peer counselor. He was able to make that contact and stay on the path to recovery. A social worker from the Union Gospel Mission who helps people sign up and sees how these phones literally give people a lifeline to family and critical resources, and often a way to get off the streets. Now they have a phone number to give an employer and a housing application. Although the phones are provided free with federal support, Oregon has one of the lowest utilization rates, with only 17% of eligible people receiving them. After discussions with Care Oregon, the Public Utility Commission, the Citizens Utility Commission, the Oregon Association of the Deaf, and the Governor's Office, there was a group consensus to establish a 9-person Oregon Telephone Assistance Program Advisory Committee to increase utilization of the Lifeline program. So this is a complete gut and stuff. The task force will set goals for participation rates in the Oregon Telephone Assistance Program, advise the PUC on the eligibility process and program regulations, including methods to streamline eligibility determinations, improve handset activations, use of Social Security numbers and other identifiers, and examining a comprehensive human services outreach approach. Review of other states' participation rates and processes that increase participation, create a strategic plan to achieve these goals, review annual participation rates, including change from previous fiscal years. It will also recommend budgeting funds for outreach and marketing, developing partnerships with low-income constituency groups, and coordination between state agencies that serve the targeted population. HB 3268A also removes the sunset on the PUC programs that provide assistive telecommunication devices and adaptive equipment for the deaf. I want to thank Martin Taylor of Care Oregon for championing this bill, the brave consumers for sharing their stories with the Healthcare Committee, and everyone on the work group that helped reach an agreement on this bill. House Bill 3268A passed unanimously out of the Healthcare Committee, and I urge an aye vote.
Further discussion? Seeing none, Representative Keny-Guyer, do you wish to close? She does not.